Have you ever wondered what it's like to be trapped in a cycle of thoughts and behaviors you can't control? Welcome to the intricate world of obsessive-compulsive disorder, or OCD. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, OCD is a chronic ailment where an individual grapples with relentless, uncontrollable thoughts, known as obsessions, and repetitive behaviors, called compulsions. Picture a mental loop that's hard to break free from. Understanding OCD is the first step towards helping those affected by it. What does it feel like to live with obsessive-compulsive disorder? It's a question that may be difficult to answer without delving into the core symptoms of this condition. At the heart of obsessive-compulsive disorder, or OCD, are two key components: obsessions and compulsions. Obsessions are repeated, persistent, and unwanted urges or images that cause distress or anxiety. These aren't just everyday worries or concerns. They're intrusive thoughts that can make a person feel uncomfortable, frightened, or even disgusted. For instance, someone with OCD may have an intense fear of germs or contamination, leading them to avoid certain places or activities. They might experience unwanted, forbidden, or taboo thoughts that seem to come from nowhere, causing immense distress. Or they may have an overwhelming need for things to be symmetrical or in a perfect order, with even minor imperfections causing significant anxiety. Compulsions, on the other hand, are repetitive behaviors that a person with OCD feels the urge to do in response to an obsessive thought. This could mean excessive cleaning or hand washing, ordering and arranging things in a particular precise way, or compulsive counting. These actions are not enjoyable, but are performed in a desperate attempt to reduce the anxiety caused by the obsessive thoughts. But perhaps the most challenging aspect of these symptoms is their impact on daily life. They can be incredibly time-consuming and significantly interfere with a person's daily activities and social interactions. The distress caused by these symptoms can be overwhelming, making it important to recognize them early. So, what have we learned about obsessive-compulsive disorder? Well, we've come to understand that obsessive-compulsive disorder, or OCD, is a chronic condition. It's characterized by two main elements: obsessions and compulsions. These are not just simple habits or quirks, but are intense, uncontrollable thoughts and behaviors that repeat over and over, causing significant distress and interference in daily life. We've discussed how these obsessions often revolve around certain themes like fear of germs or the need for symmetry, and how compulsions are repetitive behaviors or mental acts that a person feels driven to perform in response to an obsession. Most importantly, we've emphasized that if you or someone you know is displaying these symptoms, it's crucial to seek professional help. Mental health professionals can provide a proper diagnosis and guide you towards effective treatment options. Remember, understanding and recognizing OCD is the first step towards getting help and managing this disorder.